There was just a recent, predictive model that was developed by Kaiser Permanente that allowed you to stratify the patients into different risk groups and then intervene on them. So Kaiser is nice because they're a health plan and a provider, so they have both the EHR and the claims data. They're able to put it together and see the full picture for a patient. For us, we are a provider, and so we see all this data in the EHR. To implement the risk model, what we realized is we don't know how much of the care the patients get out of our system, right? So how complete is our predictive ability? So are patients who are predicted to be low risk truly low risk, or are they getting some of their care at the system down the street that actually may increase some of the measures that we pick up from that, may move them into moderate risk or high risk? And so that's, those are some of the challenges when we have all these different data for any given patient sitting in different data silos, to bring them together to actually do meaningful analytics around long-term chronic care. Now, obviously, in acute care in a hospitalized setting, it becomes much easier to be able to have that integrated data. But if you're looking at ambulatory sort of chronic care long-term predictions, it becomes much harder to just rely on EHR data, just because of the lack of completeness and not even knowing how complete those data are in the first place. I think we can get systems to use it a lot more if they're tied to interventions then based on that predictive analytics that have been shown to deliver better outcomes, lower costs, better reimbursement, whatever it might be, if there is tied to both the action and outcomes. Because like I said earlier on, I think there's a lot of predictive analytics, but it's always not clear what the exact action is, or even when the action is there, does it really lead to better outcomes? That uncertainty, I think, limits the ability of individuals and systems to sort of invest in that. Is it going to deliver on the outcomes, especially given the finite resources? Is that an area that you invest in, especially for smaller systems? I think is one of the key pieces. I think if we can create sort of a broader toolbox of both implementing and tying actions to them, I think the uptake would increase quite dramatically. At least that's my sense. I am also a little concerned broadly about the predictive analytics that are being generated. Are they using rigorous methods? Are they calibrating and validating using good methods? Now with the availability of data, that's one of the risks that systems or others may not be as cautious in testing and using predictive analytics, that we need to be careful about.